purchase medical debt in bulk in large portfolios for pennies on the dollar, and we leverage philanthropic funds to do that. And then once we obtain that debt, we have two criteria. So we help people who earn below 400% of the federal poverty level, or if their bills are more than 5% of their income. So once we determine that, we push out letters to all those individuals to let them know they're free and clear of those debts. There's no tax burden to them because it is a gift from a disinterested party. And so through that cycle, we're able to hear back from constituents. So people come back to us through their letters, which include a QR code to tell their story. And that's really important because it allows us to build the narrative and share with the world what the experience of medical debt is really about. And I'll talk a little bit about some of the polling that we've done through our research arm, which really highlights what you said, Governor, which is that the mental harm and stress of medical debt is overwhelmingly the #1 concern for individuals. And second to that is not going back to their provider, right? And we can see what that actually will mean for people in terms of their health and wellness, as well as their financial security. So across the nation, I would say this issue has really grown leaps and bounds for our organization. We've grown in our work. We're now I think we've abolished almost $28 billion worth of medical debt nationwide for almost 15 million people. And in parallel, we've seen a sort of surging of policy action, right, across states. And they range from, stopping putting medical debt on credit reports, to limiting interest rates that you can charge people for medical debt, to improving and making financial assistance or charity care more robust and accessible for people. So I think what's exciting about that is that North Carolina entered at a unique moment, and it took all of it, right? And so that's what really differentiates it, is that one, they were able to engage and have all the hospitals in the state participate. All of these 99 hospitals are actually donating their medical debt, so that makes it feasible for a charitable organization to come in and administer the debt relief. And then second, what you did is think upstream. So you had sort of a portfolio of policy options from across the country that people were testing, and you could take this one and that one and this one. And so it created sort of an arc of policy work upstream of interventions, right, that could mitigate the harms of medical debt, so that once people have their medical debt relieved back to 2014, then they know moving forward that there are more robust and better options for them than carrying those debts moving forward, and better protection. So I think that it creates all of these and supports all of these protective factors that we want for individuals, so that they return to care, so that they see their doctor and they get the care that they need. So it's really exciting to be a part of a project that is so forward-looking. But I think too, as I mentioned before, we just actually released polling last week because we do some research work. And I would say overwhelmingly across the political spectrum, people want states to act. So that's also a place where I think North Carolina is ahead of the game. So we heard that from voters that 76% of them, regardless of party, want their states to act on the issue of healthcare affordability, because medical debt is such a burden for them. So there's such intense support for this issue. There's bipartisan support. It doesn't matter, what team you're on, right? That everybody wants this relief and everybody wants action from the states. So North Carolina should be